Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental wellbeing. This episode of the Mental Wellbeing Show is with Dr. David Carreno. Dr. Carreno is a health psychologist and psychology researcher, as well as a pioneer in the field of existential positive psychology. In this episode, we discuss meaning in life, the importance of awareness of our own death, coping with distress, and how terminally ill cancer patients cope with psychological distress at the end of life, and the field of existential positive psychology. This episode is steeped in psychology, in philosophy, in spirituality, and in humanity. Now to the episode with Dr. David Carreno. Dr. Carreno, thank you for joining me on the Mental Wellbeing Show. I wanted to start by asking you what motivated you to spend so much of your life researching meaning in life?
Okay, hello. Thanks for inviting me. It's a pleasure to be here. Um, how I entered in the meaning life field. Okay, I suppose since I was a child, I was very focused on this existential aspect. I thought about my life, like the whole thing, like considering the one day I was gonna die, and it was interesting for me speaking with other children or my family about death and how they try to avoid this topic. Even everybody knows that it's something we have to come across. So I was also focused on how people try to direct their life to something worthy or meaningful. And I saw many people didn't weren't focused on this meaning in life. They were like navigating in life more automatically, unconsciously. So I, since this time in my life, I was interested in the consequences of having a meaningful life or not. And in my case, also, for me, I always had a direction, which was to contribute in the academic area and to help others and to learn to be a psychologist. So I guess this was the root, the source of the decision. And during the bachelor, I was focused on contextual psychology. So I did my master in third wave therapies, like particularly in acceptance and commitment therapy. And they work with values, and they don't call the meaning in life. And now I think they are getting more close together, the existential view and the contextual psychology. There is no problem now talking about meaning in life, which is practically the same like personal values. And after finishing my master, decided to do the doctoral thesis about meaning in life and psychological well-being in addiction, cancer patients, and university students. So I did a few internships with Dr. Paul Warren, who is a very important researcher in the field, and he is the person who developed the existential positive psychology, which is also called a second wave of positive psychology. And yeah, I started to do like empirical research on this field. I learned a lot from cancer patients. Some of them, the ones who participated in my study, they were terminal. Some of them died a few weeks after the study, and we were talking about what was important for them in life, in from this perspective, when you feel that life is going.
Such an interesting area. And in your work, particularly with cancer patients, I know you did a lot of research on coping styles in times of distress. So I want to know um, what are the different types of coping styles and how can they help or hinder us in life?
Okay. So coping in general is focused on how we manage stressful situations when you need to activate more resources that you expect. It's something that's because the reason because it's stressful, because you have to, you know, to move a lot of resources. So in the literature, the most important coping strategies are problem focused and emotion focused coping strategies. Problem focused coping is is about resolving the problem itself. It's focused on the task, the problem you have in front of you, and how rationally like solve the problem, problem solving. And some strategies also can be like planning or active coping, instrumental support. For example, in the context of the pandemic, to follow the safety rules, to wear masks or lockdown. It's something more like about the problem itself. Emotion focused coping is focused on your emotional response to the stressful situation, how to regulate your emotions. Normally, is based on avoidance. It's you are stressed, and then it's aversive. You have the negative emotion and thoughts, and you try, to do something to reduce this intensity. And for example, you can use denial, like to say this is not true. You can use drugs, uh, venting, expressing, ask for emotional support, to share. And but there are also emotional strategies which are like based on approach, which is acceptance. You contact with your emotions, integrate and continue, like focus on what you value, or humor. So, in an international study we did during the beginning of the pandemic, we saw like active coping, some kind of problem focused coping, and acceptance and humor, they were important in the prediction of mental health. But to a big extent, there was another coping style who was the best predictor of mental and physical health, and this was meaning centered coping. Meaning centered coping, we introduced this term in the last years, it's not the same as meaning focused coping. That's the reason because we tried to modify the term. Meaning focused coping is based on the belief changes. It's more cognitive. So we try to integrate cognitive, behavioral, and emotional strategies which are related to meaning in life, to the promotion of meaning in life, particularly in difficult situations. So meaning-centered coping is it's a set of these different strategies, such as positive reframing, hope, existential courage, life appreciation, and engagement in meaningful activities to be productive, to be uh, like responsible, and also it's based on prosociality. It's how you contribute to others. So it's a combination and integration of all these strategies, which are based on evidence for separate, and we saw that it was the best predictor of mental physical health in comparison with problem focus and emotion focused coping. And we did this study with 30 countries, so it was something like a strong evidence to show like the superiority or the importance of meaning centered coping.
So when I was reading that, Dr. Carreno, what came to mind was Viktor Frankl's work, "Man's Search for Meaning." I'm sure you've come across that text, and many listeners may have, in the sense that even in the deepest times of suffering, if you're able to find that hope and a sense of purpose, that can really kind of augment your well-being, even in severe suffering.
Yes, actually, meaning centered coping is based on the Viktor Frankl's work and Paul Warren work on meaning in life. And yeah, Viktor Frankl spoke of the freedom of will, which is a freedom of choice. Even in the most difficult situation, you still have the opportunity to decide your attitude towards the situation. and there are meaning, potential meaning in every situation.
Reading Viktor Frankl's work, what I took away was that even in, he was going through the concentration camp, right, in Nazi Germany. So, this is very obviously severe human suffering. But it sounds like this is meaning centered coping is something that we can apply to all levels of suffering that we go through. Is that a fair kind of statement?
I think so. I think so. But I would say it also depends on the resources of each person, because it's very easy to say you are free to choose your aptitude, but I mean sometimes difficult situations are so intense that you need help. You may need help, like therapy, for example, and it's a it's very easy to say, okay, people should trust in themselves, themselves, in order to move forward. But sometimes people have these problems of confidence, and if somebody trusts you or you work with another person like a psychotherapist who is relating to you like in this acceptance way, like in conditional rewards, it's easier that you start to change the way you relate to yourself. So I would say many people, of course, can like practice meaning-centered coping even in the most difficult situation. But I also understand that some people also like need help, and because I see it in my in psychotherapy with some clients, because you say you can practice this, is sometimes it's not enough. You need to do something deeper, you know, in the base of the self, which implies relationship, and it's more complex than normally is, it's self.
And so, with these coping styles, I found in my own experience, it's often so easy to fall into the trap of using those avoidance coping styles, procrastination or suppressing my emotions. I'm wondering, why do you think it's easier to fall into, yeah, that trap, and why do people find difficulty engaging in meaning centered coping?
Because we are programmed to pay more attention on negative stimulus because of our evolution, because it's been very adaptive to avoid threats in our evolution. And there are studies in personality and other fields that demonstrate we we respond more to the negative events than to the positive ones. So actually, if you are only focused on the positive things, you're gonna have problems, because you also need to respond with avoidance sometimes to reduce stress, but other times it's a problem because it blocks you towards your meaningful direction, to have a meaningful life. So we are programmed to avoid, but at the same time, I think our system in Western cultures are focused on this like short-term stimulation, to have pleasure all the time, like to feel positive emotions constantly. So people think that you can live in this way all the time, and it's not true, because you are gonna have to come across suffering in life, problems, traumas, and you need to respond in a you know in an adaptive way over to this. So it's a mix of our evolution and also our system. You know, we negative things we try to remove. Probably the system is reflect on the evolution, human evolution. So it's normal, but it's not the only thing. You also need to focus to approach the positive things and follow your personal values. Otherwise, it you are empty.
Mm. That's so interesting, and that really rings true that we live in this like almost hyper convenient lifestyle where distractions are just a click or two away, right? Netflix, Facebook, social media, whatever it is. And it's so easy to go down that rabbit hole, isn't it?
Yeah. It is. And over time, I think it's more and more. But when we have like global problems like the pandemic, the war, the economical crisis, then we have to do something different. That's the reason because after global crisis like the Second World War, psychology and all these existential things developed a lot. Like for example, Franco, because we need to do something else with the problems, not only avoid them. Sometimes you cannot avoid a problem, but many times actually, because for example, if you try to avoid a negative emotion or a negative part of yourself, I mean, it's not something external you can avoid. You are avoiding yourself, part of yourself. So you break into pieces. Do you know what I mean? So it's not possible to escape. It's with you. All the places you go, it follows you. These negative thoughts, these negative emotion.
Mm. So this is the reading on existential positive psychology, the dual existence of human nature, right? That we need to engage with the positive and the negative emotions.
Exactly. Existential positive psychology is a combination of humanistic existential psychology and positive psychology. So it includes the negative aspects of our existence, traumas, death, and suffering, and it's focused on meaning in life, like in existential psychology. Meaning in life is fundamental, but it's also committed to the empirical study, like positive psychology. What is the best thing, the positive side of life? What make us to be happy and to have well-being, the positive things. So it's both integrated in order to develop a theory of well-being, which is more, you know, existential, like more integrative.
And in terms of that, I suppose.
Because in
You go. Sorry, you go.
uh, I was going to say that positive psychology was a very important step in psychology, in the history of psychology, because before this movement, psychology was very focused on psychopathology. This is what is wrong with us, the symptoms, the disorders, and it's true that humanistic psychology started to think about what makes us happy and fulfilled, but there was a need of empirical study, deeper scientific study, and this started with positive psychology. But the problem was that then positive psychology, the first movement, forgot like the negative things and the importance of integrating and how to deal with the negative things in order to be happy. So the second wave of positive psychology is existential positive psychology. They are the same thing. They try to integrate the both sides.
Mm. This what's coming to mind, Dr. Carreno, is have you heard of the thought experiment, that the pleasure machine by Robert Nozick?
The pleasure machine.
Yeah, the experience machine where you.
I
Mhm.
I think so. Yeah, yeah.
Yeah, so it kind of rings true to that, right? In the sense that, even if you could have this synthetic world where you have only pleasureful and positive emotions, that a lot of people wouldn't actually go into that. That there is value in adversity, in the negative side of life, and we need to engage with that. And that's that concept of mature happiness that you've researched a lot on.
Exactly. It's interesting that people pay for going to a cinema to see a thriller, which makes you feel fear. Fear can can motivate us towards fear. There is something like positive also in negative emotion and things. Of course, in the stressful situations, you can grow personally a lot. We have the post-traumatic literature about this. Many people, after having a chronic disease or a near-death experience, they even they have more meaning in life than before, and they grow personally in different aspects, also in relationships. And so, to the point, major happiness is like the positive state uh, based on inner harmony, tranquility, satisfaction with life. This is the result of living in balance between the positive and the negative aspects of your life. So it's the overall mental state. It's based on the peaceful, to have peace of mind, like this equanimity, and not the excitement, like the happiness normally, or many people think like only positive, to be excited, to be activated. Inner harmony as a mental, as conceptualization of well-being is based on, you know, harmony, harmony with yourself, all the parts of yourself, and harmony also with others and the world.
So, you mentioned something there, post-traumatic growth. So it sounds like there's in adversity there is opportunity for us to grow, opportunity for us to find meaning. And to do that, we need to engage with the adversity, not distract and numb ourselves from it. Is that a fair kind of summary?
Yes, because if you try to avoid and not take it as a challenge or as opportunity, then you are gonna have a bigger problem. You have the problem of the situation, which is difficult, but you also have the problem that you deny the situation. So if you try to see what you can learn from the situation, the adversity, and how to integrate this situation into your meaning in life, and it's more adaptive. But it's something that which is demonstrated in the literature. It's That is the best way to cope with adversity. Otherwise, it's like, what can you do? You cannot live trying to avoid forever a situation that follows you. Otherwise, you are in conflict forever.
So I'm just trying to think. So I'm just trying to think of an example, like in my life, right? If my parents, for example, if they passed away, that they're alive now, thankfully, but if they passed away, that would be something that's extremely traumatic for me. I would find it difficult, at least initially, certainly, to engage, to use approach and meaning centered strategies, I think. And I think I would find it easier to avoid. So, using that as an example, how can we say go about, engaging, using meaning centered coping and leaning into that, the suffering there to find those opportunities and the meaning there?
The first step is to recognize the impact that the situation had on you, like your emotional response, the painful emotions you have. It's it's very aversive. It's very difficult to contact voluntarily, and then you also can see what you want to do with these negative things, which is try to avoid, or you try to be in contact until you can integrate. So, and the following steps have to do with meaning center copy. It is how I I learn, how can I integrate this very difficult experience in my life. And in the case of grief, it's grief, the name, right? Like when you lose.
Yeah. Mm.
In the case of grief, you have uh, the clinical goal is to integrate these people in yourself. You have to accept that their bodies, like physically, they won't be anymore, but the essence of the person is inside you, and you can relate with this figure, with yourself somehow. So you don't have to avoid these painful emotions, but it flows, inside you. You can relate. how they were important for you in your life, how they can still continue being important for you. And this is more the meaning centered coping in Greece. Integration of the people inside. But it's very difficult. It's very painful. Your parents, it's very easy to say. uh, You sometimes need to share with other people this intensity. You know to be more manageable, addressable.
I wanted to ask about the role of spirituality and religion. Where does that come in terms of meaning centered coping and finding meaning in life?
This is what I call self transcendence, and what Franco's called self transcendence. Is spirituality has to do with the ultimate meaning in your life, it's your whole life in a bigger context. And religions normally put this self transcendence aspect in God or different gods, but it's not the only way to be spiritual. Spiritual means like trying to connect with nature, with other people, beyond yourself. And this is the way I understand spirituality. Actually, is defined in a similar terms, like the ultimate meaning in your life in a bigger, picture. And that's something you can study on it. It's not something, pseudo scientific. It's not something. It's something that can be. You can work. It's you can do empirical study depending on the definition you provide. Mhm. So it's very important. It's the core. It's the core of meaning in life, but it's not only like the religious perspective that normally people have about the spirituality.
I wanted to put a quote to you from Viktor Frankl. So a bit left of field here. Um, those who have a why to live can bear anyhow. What does that mean to you?
That means that i- there must be meaning in suffering also. Suffering is there because of something. It has a function in our evolution, and Viktor Frankl said you have to discover the meaning. You don't have to build to construct the meaning, you have to discover what is behind this situation. And of course, that this spiritual aspect, like the meaning in your life, can be beyond your life. So even in the face of death, many people they show this you know courage and a meaning centered coping. Many people. So it's something that goes beyond suffering and even death.
Mm. It's very poignant and beautiful, I think, that quote. And it ties in, I think, a lot with what you're researching. So, yeah. Um, is there any kind of advice or anything you wanted to share with listeners that you think would be of value?
Yes, I think there are at least one very important point, which is mortality awareness. Try to think in your life as a whole and try to think what you want to do with your life in a bigger context, not only towards yourself. And when you are going to make a decision in your life, an important decision, in my case and my clients, I see it's very important to consider, like, you know, your deathbed or your mortality, because from this perspective, it's easier to see the consequences of your acts whether they are active acts or passive acts. If you don't do something, then there will be consequences. But people are not in contact with the consequences of their acts, which is something I mean extended in our culture, but they are there. This is responsibility to respond to the consequences of your action. You know, so this is one point to meaning in life, and the other point is the importance of relationships. Relationships in terms of we we core ourselves like I'm David, you are Indica, because somebody, other people, called us in this way. We speak, I speak in Spanish, you speak in English or another language, because somebody spoke to us in this language. So the same way ourselves are to some extent dependent on the relationships. It's the origin of the self, and I would say it's the end of the self also. So have this connection with others. Others can be people, others can be animals, others it can be nature, it can be society, God. But I mean, it's not about only you. It's everything is connected. If you think deep about this, so this relational aspect to have in mind that these relational things are fundamental for mental well-being, for meaning in life, and yeah. And if it doesn't work, it can be the base of happiness and well-being, but it can be also the origin of disorders. If somebody relates to you, an important, your parents like didn't treat you well, then you're gonna have problems of self-esteem, and you are maybe more avoidant focused. And it's very important that there is a study comparing the three main components of meaning in life in the prediction of uh, global meaning in life. There is the tripartite model, which is based on coherence, which is like understanding and perceiving order in the world, in yourself, and your place in the world. It's also there is the second component, which is purpose. It's the direction, aspiration, motivations. It's motivational aspect, and the mattering or significance component, which is based on the feeling that you matter in the world, not in the planet, but in your world, in your context. When these three components were compared in the prediction of meaning in life, mattering was the most important thing. Like it was a better predictor of meaning in life than the other two. So this is about self-esteem also. And if people treat you with importance in your life, it's easier that you perceive yourself to be important in the context. So this is the basics. This is the base of meaning in life. It's, at least it's one of the basics.
I mean, every theory of well-being I've looked at, Riff's psychological well-being, Corey Key's dual continuum, Seligman, they all have a component of relationships in them. That just thing speaks to your point.
It's not the only thing. For example, mindfulness, experiential appreciation. Uh, the, for example, the last year we published an article in Nature Human Behavior demonstrating that there is a fourth component of meaning in life, not only the three components I talked about, which is experiential appreciation. This is to be mindful, to be connected with here and now, and value or appreciate the experiences you are having in your life. Sometimes this was even a better predictor of meaning in life than the other three. So it's not only relationships, but it's just in the basic, in the base of our personality, in our meaning in life. It's it's something relational, dynamic.
Your first point about kind of death awareness or mortality salience. How do we go about incorporating mortality salience in a functional way without it becoming morbid and just paralyzing you?
You mean when somebody is very frightened by death and it's in panic and he's blocked, right?
I mean that's an example, but let me clarify. I mean more in the sense of if I'm constantly thinking about death all the time, I feel like that can become a negative experience, and I feel like that can stop me from that experiential appreciation that you were talking about and enjoying the moment in itself. How do we balance the two?
No, no, no. I don't say, and I don't think that you have to be thinking about your mortality all the time. Then you cannot live. It's to make important decisions. That's like often, but not always. And of course, you have to be like in the moment to respond to the experience you are having, and that's very important. But the problem is when you don't consider your death. Never. And trust me, there are many people they avoid death to all costs, and that's a problem. Yeah, actually, I see it in with my clients, and I see radical changes, like clinical changes, when some clients are like they are not they don't accept death. They try to avoid death awareness all the time. And when you try to put them in contact with death, with acceptance, normally you have to share in a safety situation, like talking about this because it can be very intense. And they they count on death in their normal lives. They can think about this, uh, even if it's negative, but they still can think and accept. I see radical changes. Their lives start to be more meaningful for them. They talk about this inner harmony, major happiness experience because they don't actually, if you try to escape from death, you are escaping from life because death is in life. And if you are gonna die and you are trying to escape from death, you are escaping from some part of yourself, your existence. And that can make you be confused or disorientated, like, lost. Mhm. So it's a very important source of meaning.
Mm, yeah. Mm. Okay, finally, I wanted to. There's one area we haven't really talked much about, which I was really interested in, and this is where I started when I was reading some of your papers, which was your work. You mentioned it earlier, but with terminally ill cancer patients, and you found when these patients were at the end of their life, a lot of them, I think, in palliative care, there was a significant shift in their personal values. Can you speak to that a little bit? Because that was really interesting.
Yeah, it's a pity that we haven't published yet the main study with cancer patients. It's in my doctoral dissertation, and I'm gonna try to submit it soon to a journal. And yeah, we have introduced the term meaning in life adaptability. Now, in the literature, uh, it is known that people alter their system of values or their meaning in life, but normally when researchers speak of meaning making in these cases in cancer terminal diseases, they focus more on how you make meaning of the disease of your cancer experience in the whole context. How you integrate this in your meaning in life. It doesn't mean you have to modify your meaning in life, just only integrate this situation here. We we saw there is a different process, which is you also need to modify some aspect of your meaning in life, your value system, in order to adapt more to the cancer conditions. And so we developed a scale to to evaluate uh, changes in personal values, and we saw this is very important. People who are more flexible in their personal values and meaning in life, they have more quality of life and more meaning in life. It's something intrinsically connected to meaning in life, this adaptability, you know?
Yeah, fascinating, fascinating. Um,
And not many people, some people are rigid. They don't want to change. They don't want to art. This is my meaning in life. This is important for me. And cancer is not going to change my worldview. This is a problem. Statistically, people with this rigid system of values, they have less quality of life and less meaning in life.
mm. So yeah, that adaptability, that flexibility almost.
Mhm, mhm. Flexibility is not only about acceptance and how you relate to negative things, negative emotion and thoughts. Flexibility is also the flexibility of your personal values. It is not I change my personal values. It's not about this. It's you still value the change. Is how you try to adapt the reality you have in what you want to do with your life. It's you don't the how do you say you don't say no to your values. You just make do shifts, some changes to to integrate.
Mm, mm. Well, thank you very much. This has been such an insightful conversation. In wrapping up, if people wanted to find out more about you, your work, existential positive psychology, are there certain places that they can go?
Uh, for example, in my profile on ResearchGate, I also have a website, but it's in Spanish. So sorry, I will do it in English in the future. But yeah, all the articles about my research and my colleagues' research is on ResearchGate. And about existential positive psychology, you can go to the Paul Warren's website, and there are lots of articles and information about existential positive psychology, the evidence of this. There is also a special issue in Frontiers in Psychology during the pandemic, specific of existential positive psychology and empirical support of this paradigm.